This is Dr. Charles from NexGenEsis Healthcare. This is phase 1 of shoulder stabilization. Now, the shoulder is the most mobile joint in the body, right? That comes at the cost of stability. It is the least stable joint in the body. There are about, right off the top of my head, about 9 muscle groups that help stabilize and move the shoulder. Now, a lot of rehab programs that I've seen go straight to this. I mean, range of motion stuff, that's great, but strengthening is the more long-term solution to getting function back and making sure that the integrity of the shoulder, the longevity of it, is maintained. Now, what phase 1 of shoulder stabilization will focus on, it is not the rotator cuff muscles, since they are small and vulnerable. They're usually the things that cause a lot of people pain. So, I have plenty of patients that say, when I do this, it hurts, but I know it's good for me. It's my exercises that I was told. No, that kind of pain is not meant for you to fight through. What we will focus on are the big muscle groups. Before I go over these muscle groups, there is a proper way to prepare for shoulder movement. Okay, biomechanically speaking, and this is a lot of people, especially with people sitting all day for work, right? What happens is, because of muscular imbalances, I probably talked to you about this already, but eventually the shoulder blades start winging out this way. You see the head comes forward, the shoulders round forward. This is due to certain muscle groups becoming weaker because it's not activated throughout the day, versus certain muscle groups getting overworked from holding you up this way. A lot of people who have pain right in between the shoulder blades, top of or the base of the neck right here, base of the skull, that's what all that one is for. Now, it is very important before you move your shoulder for you to focus on squeezing the shoulder blades back and down. We call that setting the scapula. Go ahead and set your shoulder blades so that it is closer towards the spine and you're pulling it down this way. This does not move. You start here and you end here, okay? Another very important thing is, at this time, it doesn't matter what exercise it is, this arm joint this arm bone where it makes the shoulder joint, it should never be completely horizontal. See, if completely horizontal is 0 degrees right here, you want this to be 15 degrees or in front. We call this the scapular plane. Right? So, for example, let's say eventually when we would start doing something like military presses where you're lifting above head. You notice how I'm not doing this. It's my shoulder blades are set, 15 degrees in front, and this is how you do a military press. So, going back to the chest exercise, it's the same thing, right? You notice how my shoulder blade is going to be set, right? It's set towards the spine, and my arm here is not completely horizontal, okay? It is 15 degrees in front of me. My elbow is slightly bent. It is important that your elbow does not move through this exercise. So my shoulder blade set, elbow bent, arm 15 degrees front of horizontal. All you're going to do is focus on your chest, bring it in right here. And you should feel it right here. This is called shoulder abduction. It's adduction. So a few things. Number 1, you want to take the entire motion as slow as you can. Okay, control the movement using your muscle throughout the entire process. Number 2, you notice how, as I do this, give this a nice squeeze at the end, slow on the way back. Now, if I go back any further than this muscle gets a chance to rest. Do not let the chest rest. Do not let the muscle rest. Keep it engaged the whole time. Okay, so you're right here, slow. My shoulder blade set, 15 degrees in front, right here. Boom. So on the way back, don't let it rest. Now, as you continue to do this, you're gonna feel a burn in your chest muscle. It's starting to get tired. It is very important that you try to fight through the burn as much as you can. The only way your muscle will get stronger is if you challenge the muscle tissue, right? So you're going and it's getting tired and you have to do one of these, you got one left right there. Good, now you gotta stop, give yourself a 2-minute break and repeat the process one more time, fatigue out one more time, okay? Now, the back muscle. Something like rows are great for this. Now, when I have people show me a row, a lot of people make this mistake of, that's a row, right? This is a row right here. Instead of focusing so much on just pulling, instead of the pulling motion, right? What you need to focus on, if you would take a look at my shoulder blade is winged all the way out right now. From here, what I'm gonna focus on is the muscle in between the shoulder blade and the spine, right? So it's this muscle right here. And what I'm gonna do is using this muscle, I'm gonna squeeze my shoulder blade towards the spine. If you will please notice, my elbow won't even bend on this one, right? So I'm here, I'm gonna squeeze my shoulder blade right there, and I feel it right there between the shoulder blades. Now, in order for me to maximally contract this, yes, the arm does have to come back a little bit more. I can pull it back more, but at this point, it's just straight arms, right? So, same concept, use that muscle to control the movement back. Your shoulder blade is now slowly winging out. Now, if I go back any further than this, that will rest. You keep it engaged the whole time. I'm here, squeeze the shoulder blade. That is all you're focused on. You're going back and forth, squeezing the shoulder blade towards the spine, and you should be feeling that burn between the shoulder blade and the spine. Fight through the burn, take the muscle to fatigue, 2-minute rest, and do one more set. Right? Biceps, triceps, pretty simple. Bicep curls and tricep pull downs or extensions. You can do this seated, but what is important is the elbow is right by my torso right here, and this thing does not move, okay? This arm position never goes forward or backwards, okay? It's right by your side right here, and this stays there. The only thing that will move is your elbow joint where you're coming up this way, right? So same concept, slow on the way down. If I go down much further than this, it's gonna start to rest. Keep your biceps engaged the whole time. Maybe I should use my right arm because my right bicep's bigger. But see how my elbow does not move? Or the elbow joint moves, but elbow does not go forward or backwards. Fight through the burn. Take the muscle to fatigue. 2-minute break and repeat. Now using a band. Scoot back a little bit. Using a band, the tricep extensions, the anchor needs to be above you because you're gonna need to, same position as the biceps, but you need to pull down this way and this muscle right here on the back of the arm right here. So something like this, right? So I'm here, I'm right here. This arm does not move. The elbow joint is the only thing that's moving. Boom, right here. Slow on the way back. Don't go back too far. Don't let it rest. Right here. Elbow does not move, or the arm does not move. The elbow joint is the only thing that's moving. And I'm starting to feel it right here. Fight through the burn. Take the muscle to fatigue. 2-minute break and repeat. Now, I said in the beginning that there may be a 5th muscle group for certain patients, and this is because one of the things that you should be careful of at this point is any kind of excessive overhead movement, right? The other muscle group that is also great for shoulder stabilization is your lats, the latissimus dorsi. That muscle is the one that allows you to do pull-ups, right? So for something like this, now this is only recommended if you have no trouble, no pain when you lift your arm overhead, okay? One big thing to watch out for this is never let the resistance, or the band, the weight, or whatever it is, you never let that take your arm, right? Everything is controlled, and that's why you should gradually increase the resistance and never start heavy, right? So that way you know you can control it. Something like this. To make it simple, it's always better to use a lat pull-down machine at a gym, but I'm right here. We talked about the proper shoulder movement. Set the shoulder blade back. You notice how I'm not pulling like this. I'm keeping everything in front of me, right? So set the shoulder blade in front of you, and you're pulling down like this. Slow on the way back. Don't let the muscle rest. I feel it right here. It should look just like this. Give it a nice squeeze, slow on the way back. Don't let it rest, and you're going right back down. Fight through the burn, take it to fatigue, 2-minute break, and repeat. If you do it exactly how we just went over it, you should be sore the next day. In the beginning, you might be sore for 2, 3, 4, 5 days. If you are in the muscle group, you're gonna be sore. If you are sore, you don't do it that day. Let the muscles heal up and then get back to it when you're no longer sore. If you are not sore, that's letting you know that you did not challenge the muscle groups enough. And like I mentioned before, the only way you get stronger is if you challenge the muscle groups. Right? That's phase 1 of shoulder stabilization.